I was in 7th grade when I decided I'm gonna be a doctor. Hello, I'm Dr. Gandhi. I'm a general surgeon and I'm doing cosmetic surgeries for the last 8 years. I have enjoyed these cosmetic surgeries. It is under local tumescent anesthesia and the results are extremely good and I love it. I have done more than 2,000 cases with this technique and patients have been very happy. The Awake breast augmentation infusion technique of tumescent anesthesia is a proprietary technique. Awake breast augmentation is unique in the way that patient is awake while I'm performing it. Patient has no pain, patient has no discomfort, and patient blood losses are minimal to nothing. This process is extremely safe, and while I'm performing the surgery, they have no pain at all.
So I came in and I was awake. It was amazing. I did not have any pain. Anything I did feel, he would, very careful to stop and, make sure I was comfortable with the whole procedure.
This process of awake breast augmentation, patient is completely awake. While I'm doing it, we talk about a lot of different subjects. I let them know ahead of the time what I'm doing next, so there are no surprises, and patients have been very happy with it.
I was really nervous because I didn't know what to expect. You can only hear so much, but you don't know what to expect, and it wasn't a bad procedure at all. I felt really comfortable, and throughout the whole time, Dr. Gandhi was very caring in a way where he would always ask me, how are you feeling, and always checking up on me, and it was a different experience, but it wasn't a difficult thing to go through.
Usual procedure takes between 1.5 hours to 2 hours. After the procedure, when the dressing is finished, patient walks out of the operating room. How was your experience?
It was good. It was really good. I mean, nervous, excited going in, but I'm happy.
Outside, they get instructions of how to take pain medicine and other medicines, and then they walk out of the office to get into the car and go home. When the anesthesia effects go away, patient has extreme pain. This is the similar pain if you are doing it under general anesthesia. But the only difference is as soon as you wake up from general anesthesia, you start having pain. This one, you have a more chance to become comfortable at your home before the pain comes on. And the pain is really not only because of surgery, but because of stretching of the muscle. After that, the pain is considerably decreased and the healing takes another week or 2.
I love having done the procedure. It made such a big difference. I mean, not only was I able to shop differently, but it lowered my blood pressure, which made a big difference for me. But the self-esteem issue and just the body, the way everything changed, it made a huge difference for me.
The experience itself wasn't painful at all. I mean, the discomfort was very minimal, and Dr. Gandhi was great throughout the whole procedure. We carried on a conversation and we were, making jokes, and it was a good experience. The fact that I was awake made it so much better for me, and I had fun with it.
I recommend it to everybody. People ask me, people did notice right away, and I recommend him to everybody I see and let them know.
I love my new body. I love my new silhouette. I'm amazed with the results. I can't wait to show off my new figure, so it's a good thing. It's a really good thing.
During the medical school years, I visualized myself as a OBGYN. I didn't like it. I visualized myself as a surgeon, and I loved it. So that's all I wanted to do, was a surgery. And I have been fortunate that I can pursue what my interests are, and I love what I do.